We're here today with Dr. Arun Gulani from the Gulani Vision Institute in Jacksonville, Florida. Thank you, Dr. Gulani, for being here and taking time out of your busy schedule. Welcome to Chicago, to the ASCRS 2008. If you could kind of share with us, for maybe those attendees who, or those surgeons who could not attend our meeting, what have you learned from this meeting?
Thank you for having me here, Parag. I think this meeting has been very exciting. Besides a few of the things that we were looking forward to see here, like cross-linking, collagen cross-linking for keratoconus, and personally I've been looking at this concept for even freezing the cornea after surgeries like PRK or whatever form of reshaping the cornea is. Also technology-wise, we're seeing the quantum leaps that we've seen over the years coming together. By that, I also mean combination surgeries of post-refractive IOL calculations and how to find out the safer ways of LASIK.
Now, I know that you have an interest in a technique called Corneoplastique. Describe that for us.
Corneoplastique is actually a concept which takes LASIK beyond its present levels of safety and vision. In other words, we are aiming for vision better than what we get today. Safety factors are higher because you can reverse literally any complication of LASIK back with the laser without doing invasive surgeries like transplants. It also has another level, which is correcting previous refractive surgeries like radial keratotomies, which is going to present as an epidemic now, so many people having had it in the past. And the third level is combination surgeries of whether we do phakic implants or multifocal implants and then combine that with LASIK itself.
What is it about corneoplastique that is able to reverse some of the complications that we can't do with traditional refractive surgery?
Many of the scars, as I've presented in the video here in the film festival, can be literally peeled off under the laser. Many cases you can do laser through and through the scar and bring patients to excellent vision. In some cases you build the cornea up using the 5S classification system that I proposed. So once you build the cornea up in a lamellar fashion, it's literally as an original cornea that you can now do laser for shaping and bring the patient back to excellent vision.
And describe what the 5S classification that you use.
The 5S system that I use, the first S is sight, S-I-G-H-T, which means if the patient had sight, then you, as an eye doctor, are responsible to give them back that sight, no matter what the complication is now. Number two is site, S-I-T-E. What part of the cornea is involved? Is it central or peripheral? And central is more visually significant. Then strength, is the cornea become thinner, like post-LASIK ectasia, or is it thicker, like patients with epikeratofakia or pseudophakic bullous keratopathy? And then you have the shape, and finally you have the entire structure for vision. Shape is, if you take any normal patient for LASIK, the regular shapes are nearsightedness, farsightedness, astigmatism. Irregular shapes are from previous refractive surgery, trauma, or infections. So all of these conditions make a plan for you as you're thinking without using any hype of terminology to treat nearly any eye back to its perfect vision.
Wonderful, wonderful. Tell me a little bit about your practice.
In my practice, as you can see, it's my passion to keep raising the bar on myself, trying to take vision higher and higher, not only in quantity but quality. So that is a true passion. Besides that is also raising the bar on safety constantly. So I keep innovating. I love to teach, so we have doctors who come in, and it's a great opportunity, constantly sharing information. And then, more importantly, bringing it to meetings like this where I meet colleagues like you and we get to talk some more about it. So my entire practice is a combination of innovation, research, education, driven to excellent vision. That's my drive.
That's your passion within ophthalmology. How about outside of ophthalmology? What are your passions?
Outside, my passion is fashion designing. That's something that I'm really into and I like. Maybe that's what translates into eye surgery for me all the time.
Tell me about that. What do you do in terms of the fashion field?
I love designing clothes, especially suits, and then I keep looking or get it tailored and things like that. I mean, just mixing, matching.
Are you looking to develop that as a side business maybe someday?
It's a passion right now.
So instead of Armani, we'll see Gulani.
Maybe.
Fantastic. Very good. Thank you. Thank you for joining us. I appreciate your taking time out of your schedule.
Thank you so much, Parag.
For further information, please feel free to click on the links below.